Hello and welcome back. If you're just joining me, my name is Jordan Mast and I'm a PA at the Colorado Neurological Clinic here in Denver. In this video, I'm going to take a step back from Alzheimer's disease and specifically talk about brain health. Some of the risk factors for cognitive impairment in Alzheimer's disease are modifiable, and addressing those modifiable risk factors before symptom onset can improve overall health and help to prevent other conditions as well. You've probably heard the saying, what's good for the heart is good for the brain, and this video is going to support that. Before we get to that, however, I want to make a few comments about stigma. It is so incredibly important that we address lifestyle choices with empathy and compassion. I know that many of us as PAs do this on a regular basis, but this does not change how important it is for us to keep it at the forefront of our minds. Our patients come from a variety of backgrounds and situations. If we create an environment where they fear that sharing their concerns, whether they're brain health related or otherwise, might be met with bias and stigma, some will withhold those concerns. But if we can connect with our patients and create a safe space for them, discussing brain health can be life-altering and very empowering. With that in mind, let's get into some evidence-based practices for maintaining brain health. Let's start with cardiovascular health and glycemic control, nutrition, physical activity, and cognitive and social engagement. One of the first things that we can do to help patients is to improve their cardiovascular health and glycemic control. This includes addressing things like high blood pressure, diabetes, and hyperlipidemia. Multidisciplinary care between neurologists, cardiologists, registered dietitians, and other relevant specialists is especially valuable in managing the care of those at risk. This should come to no real shock to us or even really to our patients, but physical activity can even slow cognitive and functional decline. In fact, evidence suggests that physical activity may modify the actual progression of the disease pathophysiology in those with Alzheimer's. When discussing physical activity with older adults, modifications may be needed to address physical limitations. Emphasize that new physical activity regimens should start slowly, or you can prescribe a supervised exercise program. Adults should engage at least 150 minutes per week of moderate intensity aerobic activity and participate in 2 sessions per week that are designed to build and strengthen muscle. Balance training also is extremely important for older adults. Again, these recommendations are not specific to brain health, but they certainly support it. Nutrition is particularly significant for reducing the risk of Alzheimer's disease and slowing cognitive decline. Encourage patients to consume a diet rich in antioxidants, B vitamins, and polyunsaturated fatty acids and phenols. These nutrients are neuroprotective. Some examples of foods to choose include things like leafy green vegetables, berries and nuts, beans, whole grains, fish and poultry. We can offer some concrete advice to minimize things like red meats, butter and margarine, cheese, pastries, sweets, fried foods, alcohol, and ultra-processed foods. It can be very helpful for patients to engage nutritionists or registered dietitians as well. Cognitive and social engagement can be very important. We can encourage our patients to try new things and learn new skills at any age. Participating in cognitively stimulating activities can increase brain capacity and plasticity. Patients can be creative with how they accomplish this. Choosing activities that reinforce social connection have additional benefits in terms of slowing cognitive decline, particularly as social frailty has been shown to be associated with higher risk of dementia. This is one area that I think some patients don't even really think about, as they just assume that physical activity and playing brain games is all they really need to do. Social activity and interaction is so important, and I'm sorry, but outside the family as well. Medication management is crucial for all patients, but particularly as patients age and develop multiple comorbidities. Some medications are associated with a negative impact on brain health. In fact, recent studies show that repeated use of medications like gabapentin or opioids increase the risk of dementia significantly. Reducing unnecessary medications, especially those that are sedating, such as benzodiazepines and anticholinergic medicines, is important for maintaining brain health among aging patients. Mental health conditions, particularly depression and chronic stress, carry a strong risk of developing Alzheimer's disease. It is important that we are screening patients for depression and working with them to reduce chronic stress as part of our routine care. Early treatment of mental health conditions can help to reduce AD risk. And finally, I want to talk about sleep. Compromised sleep quality and circadian rhythms are associated with an increased risk of AD. It is important to check in on how the patient is sleeping as part of routine care and address any concerns about sleep or sleep disorders. Targeted interventions that improve sleep are good for the brain. So as you can tell, it's true. The things we ask our patients to do to maintain their cardiovascular health also protect their brain. Encouraging these healthy choices is something that all PAs can do for their patients, regardless of your practice setting, the patient's age, or any of those kinds of factors, as cognitive health is a lifelong effort and it is not reserved for patients only in their later years. Together, we can help our patients live healthier, fuller lives. Thank you so much for joining me for these videos.